thanks for joining us, Dr. Lieu. To
My
start,
pleasure.
can you just give me a little bit of background on how you came to be aligned with the Colorectal Cancer Alliance?
Yeah, so this was many, many years ago, but we got introduced, and by we, I mean the University of Colorado Cancer Center got introduced to essentially Colon Town through Erica Brown, which is a colon cancer support group on Facebook that really does great work. And through Colon Town and Erica, we got introduced to Michael Sapienza, who at the time was the CEO of the CRISPR Life Colorectal Cancer Research Foundation. And we started collaborating with them as they were doing a great job with research and with awareness and really giving us an introduction and a voice to some of the patients in the colorectal cancer community. When Michael moved over to the Colorectal Cancer Alliance, our collaborations with CRISPR Life, which is now a research arm of the Colorectal Cancer Alliance, our patient advocacy efforts really did align then with the Colorectal Cancer Alliance. I would say that it's one of our most important, if not the most important, patient advocacy group that we work with within our GI group. And our work with Colorectal Cancer Alliance really centers around a couple different areas. We certainly want to help out in any way that we can with patient information and patient interaction and patient education. But we also have a lot of research interests as well. And we also collaborate with CCAs philanthropic efforts through their Undy 5000, their races, and their Blue Hope Bash and their events.
That's great. So now taking it back to your practice and your day-to-day, what kind of COVID-19 related challenges do you see impacting patients, specifically with colorectal cancer right now?
Yeah, and it's a really great question. And certainly what's going on right now is completely unprecedented. And we're learning along with our patients about more about the virus, about how to combat the virus, and what therapies and the impact of COVID-19 on our patients' treatments. And so I would say the impact for patients with colorectal cancer is really similar to the impact that we see for all patients, including all patients with cancer. And so a lot of the things that we're trying to determine together with our patients is really a determination of risks and benefits. As we well know, cancer doesn't care if there's a pandemic or not, right? And so cancer is not going to stop just because we're dealing with a pandemic, and our patients really understand that better than anybody. A lot of the risks and benefits that we talk about are, given our concern about infection, how do the risks of a particular cancer treatment weigh against the benefits that cancer treatment is obviously giving to our patients? And so I would tell you that for the most part, and certainly there's going to be some variation to this, but it's kind of business as usual in the sense that if you're a patient that's receiving treatment for any particular cancer, especially with colorectal cancer, and that treatment is benefiting you, we don't want to stop that, right? Because we don't want to be too scared of a virus that we give up medication that saves lives. And so for the most part, we're encouraging our patients to continue on with their treatment, but to understand that there may be some things that we can do to mitigate risk. So it's not a completely on or completely off decision. There's some things that we can do on our side to reduce the risk of infection. We can reduce the dose of certain chemotherapies. We can increase the interval between where we give treatments, just to give our patients a way to get less exposure to the hospital, less exposure to other people, but also maintain the treatment that they're getting.
That's great. Now, do you have any tips for patients on how to navigate that kind of thing where, they're involved in this pandemic, but they also need to maintain a treatment schedule? How can they keep themselves safe, traveling between home and hospital and things like that?
Absolutely. A lot of this is talk to your care team. I have gotten so many messages from all of my patients, and I guarantee you there's not a single message that I wanted to ignore or that I thought was too small of a question. All the questions have been great. Any question that centers around, hey, can we personalize my treatment so that it works out best so that I can keep an eye on my cancer or treat my cancer, but also not expose myself needlessly to procedures. So a couple of things. If you're on active treatment right now, have that conversation with your care team. ask the questions of, how will this impact my treatment? Should I start delaying treatment? Should I increase the interval between treatments? And that's a decision that you should make together with your doctor, so that your doctor and your care team can understand what are your concerns and how can we address those concerns. If you're currently in a surveillance period, right? So, because not all patients that have previously been diagnosed with cancer are in active therapy. So some of those questions center around, well, am I even going to be allowed to get a CT scan if it's not urgent? Because if you're in a surveillance period, you may not need a CT scan like right now. Can we delay it to May or June or even July? So have those questions, and certainly also understand that everything that we do is, surrounding COVID-19, it really centers around, obviously one, just trying to prevent you to being exposed to patients that have this virus, but also trying to limit how many touches or how many visits in a period of time to really limit your exposure risk. And so one of the things that we've done even here is try to not have our patients touch 4 different units within the hospital, but maybe try to reduce that down to 1 or 2. It seems like a small thing, but it just means that, well, you're interacting with 2 less groups of people, which can really help mitigate infection risk.
Yeah. So can you go into a little bit more around the efforts that the Colorectal Cancer Alliance is making to kind of educate and support patients like the ones that you work with?
Absolutely. So CCA has done a great job, particularly on their website. So go to the Colorectal Cancer Alliance website. They have great resources there. There's a frequently asked questions section. There's a section that really kind of explains some of the things that I'm even describing now. You can also go there for support, beyond just thinking about the science behind it and the medical aspects of it. Financial support or social support. One of the things that's really difficult whenever you're social distancing can be a feeling of isolation. And especially if you have had or currently have a diagnosis of colorectal cancer, you need people around you to help you support, to have support, because this is a tough enough diagnosis outside of a pandemic. So you throw on a pandemic and social isolation and social distancing on top of that. Really having resources to be able to even just find people to talk to know that you're not alone, that there's an entire community that is all dealing with the same things. Really, you can find a lot of support there. And the big thing with CCA has always just been support and education, and really appreciative for their efforts of getting the word out. And I can tell you absolutely that it's making a difference.
That's great. So lastly, do you have any advice kind of in that vein for patients or survivors or even caregivers who may be concerned about how to handle this pandemic right now?
Yeah, and so, a lot of the things that you read on the news, remains absolutely true. So what are some of the things that we can do to mitigate infection risk? And this is kind of what we do in general, but now it's in overdrive. So when we talk about washing your hands, we always talk about that in terms of trying to slow down infections, and especially during the cold and flu season, but especially important now. You got to wash your hands for 20 seconds. And that is not a normal thing, right? No, people don't just sit at a sink for 20 seconds normally. So there's some things that you can do, like sing happy birthday to yourself twice, or go through your ABCs, or just some kind of strategy to know that, well, when you're really washing your hands, you're washing them very, very well. Certainly, the social distancing efforts that have been implemented across the country, I think, have really helped. This thing could easily spiral out of control, particularly amongst our patients with cancer, if those weren't in place. Think about it when you think about touching high-touch surfaces. Not that a lot of people are in office buildings right now, but even if you think about doorknobs and locks and elevator buttons and some of these high-touch surfaces, anything that you can do to kind of reduce your interaction with those high-touch surfaces. So, not using something else to touch, like an elevator button, even like the sleeve of a jacket, can sometimes help. When you're out, obviously make sure that you wash your hands very, very frequently. It's so funny that these things change so rapidly. I talked about mask use previously in other talks that I've given to patients, saying, well, don't worry about wearing a mask unless you're sick. Well, now you're wearing a mask when you're out in public. These are some of the things that kind of sound like common sense, but really do save lives. And I guess the real, kind of take-home message here is that even if your risk for developing COVID-19 is really low, by doing some of these things, not only are you protecting yourself and those that are close to you and your loved ones, but you really could be saving the life of somebody that you've never met before. And I think that that's the way we need to be thinking about, is that even if I feel indestructible and I don't even feel like I'm going to get it, which again, everybody can get this. And I think that's one of the take home points. But even if you implement these things to kind of slow down the infection, I really want you to think about the idea of what I'm doing right now may not only save my life, my loved ones' lives, but really somebody that I've never met before. And if you think about it that way, I think it really provides a lot of motivation to do these things and to do them right.
That's great. Thanks for joining us, Dr. Lieu.
Thanks so much, Jessica.